So this is something I've thought of for quite some time, and again it's about health advocates, but it's having a health hub. And what do I mean by that? Well, we want to have as you say, a trusted brand. So I asked ChatGPT to make a picture of a health hub. You can see it's not quite there yet, but it will be soon. But these are the problems that we have. Dental access is poor, but I think the government have brought out an option through these health hubs that they probably won't build, but hopefully you will. And the evidence is there in the high street of what actually does work. So this is from a previous kind of pitch that I did before. We're talking about these people, treatment coordinators or health coordinators, and how they can help the public as well as generate an income. I made this for Dominic Cummings a while back, so you can still find it on YouTube. And you can see my animations aren't brilliant. But this was the idea. So as you can see, it was during COVID, because we really struggled at COVID. We weren't prepared. So we should be prepared. When you have these knee-jerk reactions, nobody benefits. We just all lose money and time. So let's think outside the box. These are the apprenticeships I was talking about. And they talk about integrating the 4 Ps. So the 4 Ps in marketing, but we're talking about the 4 Ps for health. And I originally had the 3 Ps for promoting public prevention in oral health. And now we have the evidence to show that I was wrong. It's just health. So the recent expansion of duties through the apprenticeships are here. And what we can do is use Clayton Christensen's advice when it comes to health through utilising relatively inexpensive, easily accessible premises, using relatively inexpensive staff. And it also follows the business advice of some very successful companies. And what they do is empower and trust their staff. So this is how our mainly digital health club will work. It will have a manner of digital devices, and they'll all link into a hub, and the staff will be able to use them as well as help interpret them. This is the main thing. We'll have a treatment coordinator, and what they will do is they'll forward the data, we'll get that assessed, it'll come back to the coordinator, and the user, be a patient, if necessary, be passed on to some dental units or even just some online help going forward. So the user or the patient will own and probably store their data, and this will be really useful, as now we've got these different assessment tools that don't get tired and can interpret the data more accurately than the human eye. They will only detect the health needs of the user, not necessarily what they want. Because of that, it'll be consistent. Because of that, as they won't keep changing opinion with different dentists, you'll have 30% less treatment. And some of this digital data can be used with 3D printing and generate an income. So being health advocates, we don't need to restrict ourselves to teeth. There's lots of integration with other diseases caused by sugar. And the government should have produced something that's of value for both of us with regard to diet history. So these sensors are proving extremely useful, and also people are sharing their data, so hopefully we'll have a greater understanding of both the oral and the gut microbiome, and we will all benefit in the long run. This excellent TED Talk has now had over 1 million views and explains how the mouth should be the sentinel of the body, but also the difficulties that we have when up against big business. The old graphics I made some years ago following a peer review meeting where a doctor was telling us about how she'd suffered from sepsis. Soon our watches will be telling us if we've had enough sleep and if it's safe to get up in the morning. More accurate digital monitoring devices will be at the hub. Due to health issues, the most popular app in 2021 was the COVID app. We needed it to get into the pub. It was a great motivational tool. Similarly, the Tesco Club Card has worked extremely well, especially for the Tesco finances. They have all your data and know what you want and when you want it. By the same token, if we merged it with an NHS one, such as the food scanner, it could just give you a readout every month of how much sugar you've been having. And even without the club card, Google know what you've been up to. They know where you've been, what you've bought. That's why you get all these funny ads coming up. I hope one day you'll come across the Dental Health Service app. But in the meantime, remember this. This is what we all need. We need to take ownership of our health